If the decision makers were watching this right now,
Sure.
those that were responsible for terminating you and the other 50 that are willing to get back to work, what would you say to them?
I guess I could speak for myself, but probably on behalf of the group as well. Allow us to come back to work, to do the jobs that we have studied for, trained for. We are good at what we do, we are skilled, we are experienced, and we need to be there for our colleagues, but not only our colleagues, also for the public to provide the service that we have and we would like to continue doing.
I'm Yemini for Rebel News in Melbourne, Australia, where up to 50 frontline paramedics have formed a group to fight back for their jobs after being terminated during the pandemic for not complying with the COVID-19 vaccine mandate.
Yes, Harvey, I've been a paramedic for approximately 12, 13 years, and so I was terminated, unfortunately, in December 2021 because of the mandate of a COVID-19 vaccination or face termination. And since then, myself and a lot of other people in the group, we took our matter to the Fair Work Commission. We were all unsuccessful. So as time's gone on, and we have heard even more so in the media at the moment that we've got that healthcare crisis still here, we've still got a shortage. We feel that not only do we have the statute of limitation where we need to see our terminations through the court process, but it just makes sense that we could get all the terminated paramedics back to work to help this shortage.
I was an AMBO for 15 years and I resigned under duress last year in August. I feel like we've, as a the entire medical field has really let itself down in terms of its ethics, both in terms of coercion or obtaining consent and also about privacy, medical confidentiality.
As a paramedic and as a nurse, how did it feel after 12 and 18 years being terminated for a medical procedure essentially that you refused to undergo?
Shattered. They were my dream careers, and I loved being a nurse, I loved being a paramedic, and I felt that it was highly unfair and confusing, just really confusing.
Do you think the people that were terminated or quit under duress, do you think they're replaceable?
I mean, we're all replaceable, but at the same time, they have issues with training staff already. There's a shortage of clinical instructors, and that shortage puts more pressure on the whole system and means that the new students coming through are lacking in good guidance.
I think that in all industries, businesses, you need experience, and this is definitely a service, a job where you need experience for obviously these really challenging, unwell patients, yeah.
How many paramedics do you have that are willing to go back to work that you know of?
That I know of, at least 30, 50 that would like to be reinstated, and the others, well, they can work out what they need and what they want.
I've heard the argument before from people in the public that say, well, if you're working in frontline health, you should be the one group that should be mandated to have every vaccine, including the COVID. What would you respond to them?
So we are pro-vaccines. We've had a lot of vaccines to actually be in health in the first instance, but we also very lawful citizens, and also medically we hold ethics to a high account. And so we always would like to keep to those standards, provide an informed decision to our patients, and we respect the same.
Consent's always been very important to me in terms of giving or administering any medical procedure, because even the most simple medical procedure has risks and benefits, and there's a lot of information that needs to be gathered that's very personal about each patient for a clinician to weigh up whether or not any individual procedure is going to be for the overall benefit of that patient. That just highlights why confidentiality is of so much importance, because people are sharing things with us that they might not share with their family or close friends or anything. We find the most personal details that people have, and we have a responsibility to maintain that trust by not sharing it. in any medical intervention.
So for those that do want to know a bit more about your group, what you're doing, what you're fighting for, support you, what's the website?
So the website's aw4a.com.au, and so this is our AV Seeking Remedy project, where we're calling upon the public to help. The accumulative effect of the small donations will hopefully get us the support that we need to pay for our barrister and our solicitor to see our terminations through a little bit more formally and hopefully seek our remedy that we need.
And this all can end overnight is if the government...
Easily. So we, I guess, are compelled or we have no other option, but we need to go through this now formal process because we have a statute of limitation. So we wouldn't do that if the government said tomorrow, paramedics back to work. So we're not doing it because we need to seek a large amount of compensation, or no one wants to go through a formal legal process, but we have to because we feel that we need to seek justice, we need to get back to work.
If you think it's important for the world to see what's still happening here in Melbourne, Australia, in the name of COVID-19, the way the government is actually putting our health at risk by not allowing these frontline paramedics to step back into the roles they were so good at, make sure to like, comment, but most importantly, share this far and wide, because the mainstream media, they don't actually care about our health and our safety as they pretended the whole pandemic. Because if they did, they'd be fighting for these people to get their jobs back. So it's up to you guys at home. Share this far and wide. And then make sure to head over to rebelnews.com.au and check out all the other stories that the mainstream media refuses to report. rebelnews.com.au.